If you're pregnant, trying to conceive, or have ever experienced pregnancy loss, I want you to know this first. You are not alone, and this is not your fault. Miscarriage is far more common than most people realize, and understanding what's really happening can bring clarity, comfort, and hope. In this video, we're going to talk calmly and honestly about the different types of miscarriage, what they mean medically, and why knowing these definitions truly matters for your care and your future. If this kind of evidence-based, compassionate information is helpful to you, please like this video, subscribe to the channel, and stay with me as we learn together. Miscarriage is far more common than most people realize, and understanding this reality can help reduce isolation, fear, and self-blame during early pregnancy. Miscarriage is often spoken about in whisper, if it is spoken about at all, which can make it feel rare, isolating, and deeply personal. In reality, pregnancy loss is one of the most common outcomes of early pregnancy, affecting approximately 1 in 4 pregnancies overall. When people are unaware of how common miscarriage truly is, they may internalize the experience as something uniquely wrong with them, rather than recognizing it as a shared medical reality. This lack of open conversation can intensify emotional. Many people move through miscarriage believing they are alone, surrounded by others who appear to have effortless pregnancy. Understanding that miscarriage is common does not remove the grief, but it can soften the sharp edges of shame, confusion, and loneliness that often accompany loss. Knowing the statistics also reframes expectations around early pregnancy. Early pregnancy is a fragile and complex biological, involving fertilization, implantation, rapid cell division, and genetic precision. When something interrupts that process, it is far more often due to factors beyond anyone's control rather than actions, choices, or behavior. By learning how common miscarriage is, people can begin to separate grief from guilt. Loss can still be devastating, but it no longer has to carry the added emotional burden of self-blame. Understanding prevalence allows space for compassion, healing, and realistic hope moving forward. Early pregnancy is often portrayed as a guaranteed progression from a positive test to a healthy baby. But biologically, this is not how reproduction works. Many pregnancies end before a heartbeat is ever detected, sometimes even before a person knows they are pregnant. This reality is rarely discussed, which can make early loss feel shocking and unfair. When someone experiences miscarriage without understanding how frequently it occurs, they may question every detail of their daily life. They may replay food, exercises performed, moments of stress, or medications taken, searching for a cause that does not exist. Education helps interrupt this cycle of self-interrogation. Medical data consistently shows that miscarriage is usually related to chromosomal or genetic abnormalities in the embryo. These abnormalities arise randomly and cannot be predicted, prevented, or caused by normal daily activities. Knowing this shifts the narrative away from blame and toward biology. Understanding miscarriage as a common medical event allows individuals to process loss through a lens of truth rather than fear. It reinforces the idea that grief is valid, emotions are real, and the experience does not define future fertility or worthiness of parenthood. Isolation is one of the most painful aspects of miscarriage. Many people feel unable to share their experience because pregnancy loss is still treated as a taboo subject. Friends and family may not know what to say, or they may unintentionally minimize the loss, especially if it occurred early. When miscarriage is openly discussed as common, it creates space for connection. People begin to realize that coworkers, friends, sisters, and even parents may have experienced similar losses. This shared understanding can be profoundly comforting and validating. Education also helps normalize emotional responses. Grief after miscarriage does not follow a timeline, nor does it depend on how far along the pregnancy was. Understanding how common miscarriage is reassures people that intense emotions are a normal response to loss, not an overreaction. By reducing isolation, knowledge fosters. It encourages people to seek support, ask questions, and advocate for themselves medically and emotionally. No one should have to navigate miscarriage in silence. Fear often takes root when people do not understand what is happening in their bodies. After miscarriage, it is common to fear that future pregnancies will end the same way, or that something is permanently wrong. These fears can become overwhelming without accurate information. Recognizing the frequency of miscarriage helps contextualize risk. While miscarriage is common, most people who experience one miscarriage go on to have healthy pregnancy. Even after multiple losses, the likelihood of success remains high for many individuals. Understanding probability does not eliminate anxiety, but it provides a rational. Instead of imagining worst-case scenarios, people can anchor themselves in evidence-based reassurance and realistic expectations for future outcomes. This knowledge empowers individuals to move forward with cautious hope rather than paralyzing. It reinforces that miscarriage is not a predictor of failure, but a chapter that many people pass through on the path to parenthood. Self-blame is a natural response when something precious is lost without explanation. Humans are wired to search for cause and effect, especially during emotionally charged experience. Without education, miscarriage easily becomes personalized and internalized. Learning that miscarriage is common disrupts this harmful narrative. It reframes loss as a biological event rather than a personal failure. This distinction is essential for emotional recovery and long-term mental health. When people stop blaming themselves, they can begin to grieve more gently. Grief rooted in understanding is less likely to turn into shame or self-punishment. Compassion becomes possible when blame is removed. This shift is not about minimizing loss, but about honoring it truthfully. Understanding allows grief to exist without additional suffering layered on top. Early pregnancy carries both excitement and vulnerability. Many people feel caught between hope and fear, unsure whether to celebrate or remain guarded. When miscarriage is viewed as rare, fear feels abnormal and isolating. Knowing how common miscarriage is validates these mixed emotions. It explains why early pregnancy can feel emotionally complex and why cautious optimism is a common, healthy response. This understanding helps people give themselves permission to feel however they feel. There is no correct emotional response to early pregnancy or loss. Awareness fosters self-acceptance. By normalizing uncertainty, education reduces emotional pressure and allows people to experience pregnancy with honesty rather than forced positivity. Society often places unrealistic expectations on pregnancy, portraying it as a linear journey with guaranteed outcome. This narrative leaves little room for loss, uncertainty, or deviation from the expected path. Understanding miscarriage as common challenges this narrative. It introduces a more accurate and compassionate view of reproduction that acknowledges both success and loss as natural possibilities. This broader perspective allows people to redefine what strength looks like. Strength is not avoiding loss, but continuing forward with resilience, support, and informed hope. Education becomes a tool for reclaiming control in an experience that often feels uncontrollable. Medical language and statistics can feel cold, but when used thoughtfully, they provide reassurance rather than detachment. Numbers help ground emotions in reality, offering clarity where fear thrives in ambiguity. Knowing that miscarriage affects millions of people worldwide transforms personal pain into shared human experience. This does not diminish grief, but it reduces the sense of isolation. Education bridges the gap between science and emotion. It allows people to understand what happened while still honoring how deeply it hurts. This balance is essential for healing that is both emotional and informed. Many people worry that experiencing miscarriage means their body has failed them. This belief can damage trust in one's own body and create fear around future pregnancy. Understanding how common miscarriage is restores that trust. It emphasizes that the body is not broken, but responding to complex biological signals that protect long-term reproductive health. Loss, in this context, is not evidence of failure, but part of a selective process that often leads to healthier outcomes in the future. This reframing can be deeply empowering and healing. Ultimately, understanding the prevalence of miscarriage provides permission to grieve without guilt. It allows people to mourn what was lost without questioning their worth, choices, or future. Education creates space for compassion, both self-directed and communal. It invites openness, conversation, and connection rather than silence. When people understand that miscarriage is common, they are more likely to seek care, support others, and speak openly about their experience. This knowledge transforms isolation into shared understanding and fear into informed hope. A miscarriage is defined as a pregnancy loss before 20 weeks of gestation. But there are multiple types, each with different meaning, timelines, and medical implications. The word miscarriage is often used as if it describes a single event, but medically, it is an umbrella term that includes several different situations. Most medical organizations define miscarriage as a pregnancy that stops developing before 20 weeks of gestation. Yet what happens within that time frame can vary significantly. Understanding this definition is the first step toward clarity. Many people are surprised to learn that miscarriages are categorized based on both timing and what is happening biologically in the pregnancy. These distinctions are not just academic labels. They help healthcare providers determine appropriate monitoring, testing, and follow-up care. When someone is told they have had a miscarriage without further explanation, confusion and fear can quickly follow. Knowing that there are different types allows individuals to better understand what their body experienced and why certain medical decisions were recommended. Clear definitions help replace uncertainty with understanding. They provide a framework that allows people to process loss with accurate information rather than unanswered. Timing plays a major role in how miscarriages are classified. Early miscarriages typically occur in the first trimester, before 13 weeks of gestation, while late miscarriages happen between 13 and 20 weeks. Although both fall under the same definition, they can feel very different emotionally and physically. Early pregnancy loss often happens before a person has had an ultrasound or prenatal visit, which can make the experience feel invisible or minimized by others. Late miscarriage, on the other hand, may occur after significant bonding and visible pregnancy changes, intensifying emotional. Understanding timing helps normalize these experiences. It explains why symptoms, medical evaluations, and recovery process may differ from one miscarriage to another. Recognizing that timing matters does not rank loss by severity. Every pregnancy loss is valid, regardless of when it occurs. Beyond timing, miscarriages are also defined by what can be medically detected. Some losses occur after a pregnancy is seen on ultrasound, while others happen before anything is visible. These distinctions are important for diagnosis, but do not diminish the reality of the pregnancy. Clinical miscarriages occur after something can be detected, such as a gestational sac, embryo, or heartbeat. Biochemical miscarriages happen earlier, after implantation, but before ultrasound confirmation. For many people, learning about biochemical miscarriages is validating. A positive pregnancy test followed by bleeding is not just a late period, but evidence that implantation and early pregnancy did occur. Medical definitions help acknowledge these early losses as real pregnancies and real experience. Different types of miscarriage also reflect how the body responds to pregnancy loss. Some miscarriages involve bleeding and cramping, while others occur silently, without noticeable symptoms. These variations can be deeply confusing and emotionally distressing. A missed miscarriage, for example, occurs when the pregnancy stops developing, but the body does not immediately recognize the loss. This can lead to shock and disbelief when discovered during a routine ultrasound. Understanding that this is a known medical phenomenon can reduce self-doubt. It reassures individuals that they did not miss warning signs or fail to act appropriately. Knowledge helps people understand that the body's response to loss is not always immediate or predictable. Medical labels may sound cold, but they serve an important purpose. Terms like threatened miscarriage, inevitable miscarriage, or complete miscarriage describe what is happening physically, not what will happen emotionally. A threatened miscarriage, for example, simply means there is bleeding during pregnancy, while the pregnancy may still be viable. Many pregnancies labeled as threatened go on to result in healthy births. Without understanding these terms, people may assume the worst and experience unnecessary anxiety. Clear explanations help contextualize medical language and reduce fear. Knowing the meaning behind the terms restores a sense of control during an otherwise overwhelming experience. Understanding miscarriage types also influences medical care. The approach to monitoring, testing, and treatment may differ depending on the type and timing of loss. This is why accurate classification matters. Some situations require immediate medical intervention, such as septic miscarriage, which involves infection and can be life-threatening without prompt treatment. Others may allow for watchful waiting or emotional support alone. When people understand why certain tests or procedures are recommended, they are more empowered to participate in their care. Knowledge fosters collaboration rather than confusion. Informed patients are better equipped to ask questions and advocate for their needs. Misunderstanding miscarriage definitions can lead to harmful myths. One common misconception is that early losses do not count or are less significant. Medically and emotionally, this is not true. All miscarriages reflect a pregnancy that began and ended prematurely. Whether loss occurs at 5 weeks or 15 weeks, it represents the interruption of potential and hope. Recognizing different types does not minimize early losses. Instead, it validates them within a medical framework that acknowledges their importance. Education helps dismantle dismissive language and reinforces compassion. Clear definitions also help people navigate conversations with healthcare providers. Medical visits can be overwhelming, especially during emotional distress, and unfamiliar terminology can add When individuals understand the categories of miscarriage, they can better comprehend diagnoses, test results, and treatment options. This clarity reduces fear and builds trust in medical guidance. It also allows people to seek second opinions or additional support when needed. Knowledge becomes a protective tool. Understanding medical language helps bridge the gap between clinical care and personal experience. Another important reason to understand miscarriage types is future planning. Different types of loss may guide decisions about monitoring in future pregnancies or evaluations for recurrent pregnancy. Knowing whether a loss was biochemical, clinical, early, or late helps providers determine whether additional testing is appropriate. These distinctions ensure that care is personalized rather than generalized. For individuals, this knowledge helps reduce uncertainty about what comes next. It replaces vague fear with concrete steps and options. Understanding classification supports informed hope moving forward. Ultimately, defining miscarriage accurately is about respect for the pregnancy, for the person experiencing loss, and for the emotional weight carried afterward. Language shapes understanding, and understanding shapes healing. When people know that miscarriage includes many types and experiences, they are less likely to judge themselves or others. Compassion grows from clarity. Education transforms a confusing and painful event into something that can be understood, processed, and integrated over time. Clear definitions do not erase grief, but they provide a foundation for healing grounded in truth and reassurance. Knowing the specific type of miscarriage someone experiences can provide clarity, guide medical decisions, and support future reproductive planning. Experiencing a miscarriage often brings an overwhelming sense of confusion, especially when medical terms are introduced without full explanation. Many people leave appointments knowing that a loss has occurred, but not fully understanding what kind of miscarriage it was or what that means for their body. This lack of clarity can increase anxiety and emotional distress. Knowing the specific type of miscarriage helps organize what feels chaotic. It gives structure to the experience and allows people to understand what happened biologically, rather than filling in the gaps with fear or self-blame. Information becomes a stabilizing force during a deeply emotional time. Each type of miscarriage reflects a different biological process, and understanding those processes helps explain why symptoms appeared or did not appear the way they did. This can be deeply reassuring for people who feel caught off guard by their diagnosis. Clarity does not take away grief, but it replaces confusion and understanding, which is essential for emotional and psychological healing. Medical decision-making after miscarriage depends heavily on understanding the type of loss that occurred. Different situations require different approaches, and knowing the classification helps guide appropriate care. For example, a complete miscarriage may require no further intervention, while a missed miscarriage may involve medication or a procedure to safely resolve the pregnancy. Without understanding these distinctions, recommendations can feel frightening or unnecessary. When people know why a particular option is being offered, they are more likely to feel confident and empowered in their choices. This shared decision-making process builds trust between patients and healthcare providers. Knowledge transforms medical care from something that happens to someone into something they actively participate. Understanding the type of miscarriage also helps explain physical recovery. The body's healing process can vary depending on how and when the pregnancy ended. Some people recover physically very quickly, while others may experience prolonged bleeding hormonal shifts, or delayed cycle. These differences are normal and often related to the specific type of miscarriage. When individuals understand what is expected for their situation, they are less likely to worry unnecessarily or feel that something is wrong. Expectations grounded in medical knowledge reduce fear. This clarity allows people to focus on healing rather than constantly questioning their body's responses. Emotional recovery is also influenced by understanding the nature of the loss. Different types of miscarriage may carry different emotional challenges, but all are valid and significant. For example, a missed miscarriage can be especially traumatic because it often comes without warnings. Knowing that this is a recognized medical condition helps reduce feelings of shock, disbelief, or betrayal by one's body. Understanding does not minimize emotional pain, but it validates. It confirms that the experience fits within known medical patterns and is not an anomaly caused by personal failure. Validation is a critical component of emotional healing. Future reproductive planning becomes clearer when the type of miscarriage is known. Medical providers use this information to decide whether additional monitoring or testing is appropriate in future pregnancy. Some types of miscarriage may not change future care at all, while others may prompt closer follow-up or earlier ultrasounds for reassurance. Knowing this helps people understand what to expect moving forward. This knowledge can be comforting, especially for those who feel anxious about trying again. Clear plans reduce uncertainty and fear. Understanding what happened helps inform what comes next. For individuals who experience more than one miscarriage, knowing the type of each loss becomes especially important. Patterns over time can guide evaluation and treatment. Recurrent pregnancy loss is defined based on the number and types of miscarriage. An accurate classification ensures that people receive appropriate care without unnecessary delays. When people understand how their losses are categorized, they are better equipped to advocate for evaluation and testing when needed. Information becomes a tool for self-advocacy and empowerment. Understanding miscarriage types also helps people communicate their experience to others. Many struggle to explain what happened to family or friends, especially when the loss occurred early. Having clear language allows individuals to describe their experience with confidence and accuracy. This can reduce misunderstandings and dismissive response. Clear explanations also help loved ones respond with greater empathy and support. Education fosters compassion, not only within the individual, but within their support system. Shared understanding strengthens emotional connections during grief. Knowledge reduces the urge to compare experiences. When people understand that miscarriages differ widely in timing and presentation, they are less likely to judge their own grief against someone else's. Each type of miscarriage represents a unique experience, but all are legitimate losses. Understanding this helps people honor their own emotions without minimizing. Comparison often intensifies pain, while understanding encourages self-compassion. Education creates space for individualized healing. Clarity around miscarriage types also helps reduce long-term anxiety. Unanswered questions can linger long after physical recovery, fueling fear about future pregnancy. Knowing exactly what happened allows people to close some of those mental loops. It provides answers where uncertainty once lived. This understanding supports emotional closure, even as grief may continue. Clarity creates a foundation for cautious optimism moving forward. Ultimately, knowing the specific type of miscarriage transforms an overwhelming experience into one that can be understood and integrated. It replaces vague fear with concrete knowledge. This understanding supports informed medical, emotional validation, and thoughtful future planning. While loss will always be, clarity makes it less isolating and less frightening. Knowledge becomes a powerful ally on the path toward healing and hope. Early pregnancy losses, including biochemical miscarriage, are real pregnancies and real losses, and they deserve to be acknowledged with seriousness and compassion. Early pregnancy loss is often misunderstood, both medically and socially. Many people believe that a pregnancy only counts once it is seen on ultrasound or once a heartbeat is detected. This misunderstanding can deeply invalidate those who experience loss very early in pregnancy. A biochemical miscarriage occurs after fertilization and implant. When the embryo begins producing pregnancy hormone that can be detected on a test, this means a pregnancy truly existed, even if it ended before anything could be seen on ultrasound. When early losses are dismissed as just a late period, it can compound grief with shame and confusion. The emotional pain does not depend on gestational age, but on hope, attachment, and the meaning of becoming pregnant. Recognizing early losses as real pregnancies is essential for emotional validation and healing. Many people feel pressured to minimize their grief after an early miscarriage, especially if others around them do not understand what a biochemical pregnancy. Comments like, "at least it was early," or "it doesn't really count," can be deeply hurtful. These statements ignore the biological reality of early pregnancy. Implantation occurred, hormonal changes happened, and the body began supporting a pregnancy. This is not hypothetical or imagined. Grief after early loss is not an overreaction. It is a natural response to the loss of something deeply desired, regardless of how early it occurred. Compassion begins with acknowledging that early loss is still loss. Biochemical miscarriages are extremely common, yet they are often invisible. Many people never know they were pregnant because the loss occurs around the time of an expected period. For those who do test early and receive a positive result, the emotional impact can be intense. Hope forms quickly, and the sudden loss of that hope can be devastating. Understanding that biochemical miscarriages are common does not lessen their emotional weight. Instead, it helps normalize the experience without minimizing it. Visibility and acknowledgement helped reduce isolation and self-doubt. From a medical perspective, early losses matter. They are included in definitions of pregnancy loss and, increasingly, in the evaluation of recurrent miscarriage. Each early loss provides information about fertility, implantation, and early embryonic development. They are not meaningless events to be ignored. When early miscarriages are taken seriously, people receive more appropriate care, monitoring, and reassurance when needed. Medical acknowledgement reinforces emotional validation. Early pregnancy loss can delay family building, even if it occurs very early. This delay carries emotional weight, especially for those who have been trying to conceive for a long time. The loss of time, momentum, and expectation can be just as painful as the physical loss itself. These feelings are often overlooked when losses are minimized. Recognizing early losses as significant allows people to grieve honestly rather than feeling rushed to move on. Healing requires time, not dismissal. People who experience early loss often struggle with guilt, wondering if they tested too early or became attached too quickly. This self-blame is unnecessary and harmful. Attachment does not cause loss, and awareness of pregnancy does not make grief invalid. Emotional bonds form naturally and cannot be controlled. Understanding that early losses are real helps release this guilt. It allows people to honor their emotions without judgment. Compassion begins with self-compassion. Acknowledging early pregnancy loss also improves how society supports those who experience. When losses are recognized as real, conversations become more empathetic and less dismissive. This cultural shift helps people feel safer sharing their experiences and asking for support when they need it. Validation from others can ease emotional burden and reinforce that grief is not something to hide. Open acknowledgement fosters collective healing. From a psychological standpoint, unacknowledged grief can linger and resurface later as anxiety, depression, or fear around future pregnancy. When early losses are validated, people are more likely to process grief in a healthy way rather than suppressing. This processing creates emotional resilience and reduces long-term distress. Acknowledgement is not about dwelling on loss, but about integrating it. Early pregnancy loss also shapes future experiences of pregnancy. Many people feel cautious or guarded in subsequent pregnancy, especially if their loss was minimized previously. Understanding that early loss was real helps explain these emotions. It reassures people that their caution is a normal response, not excessive. This awareness allows individuals to approach future pregnancies with gentler expectations and self-understanding. Validation supports emotional safety. Ultimately, recognizing early pregnancy losses as real pregnancies and real losses restores dignity to the experience. It honors both the biological reality and the emotional. Every pregnancy, no matter how early, represents possibility, hope, and intention. Losing that deserves compassion. When early losses are acknowledged, people feel less alone and more supported in their healing. Seriousness and compassion are not optional, they are essential. Most miscarriages are caused by chromosomal or genetic issues within the embryo, not by anything the pregnant person did or failed to do. One of the most painful questions people ask after a miscarriage is, "What did I do wrong?" This question often arises from a natural desire to find meaning or control in a situation that feels sudden and devastating. Unfortunately, without accurate information, this search can quickly turn into self-blame. Medical research consistently shows that the most common cause of miscarriage is a chromosomal or genetic abnormality within the embryo. These abnormalities occur randomly at the moment of fertilization or during early cell division and are not influenced by everyday action. This means that routine activities such as exercise, work, stress, travel, or sexual activity do not cause miscarriage. Normal behaviors cannot change the genetic makeup of an embryo once conception has occurred. Understanding this truth is essential for releasing guilt and beginning emotional healing. Chromosomes carry the genetic instructions that guide embryonic development. When there is missing, extra, or improperly arranged genetic material, the embryo may not be able to develop normally. In many cases, the body recognizes that development cannot continue and ends the pregnancy naturally. This process, while emotionally painful, is not a failure of the body, but a protective biological mechanism. These genetic changes are usually random and unpreventable. They do not reflect the health, worth, or behavior of the person who became pregnant. Recognizing miscarriage as a genetic event, rather than a personal mistake, helps reframe the experience with compassion. Many people assume that lifestyle factors must be responsible for pregnancy. This belief is reinforced by societal messages that place heavy responsibility on pregnant individuals. While certain health conditions can increase risk, the vast majority of miscarriages occur in otherwise healthy who did nothing wrong. Even those who follow every guideline perfectly can still experience loss. This reality can feel deeply unfair, but it also removes misplaced responsibility. Perfection does not guarantee outcomes, and loss is not a punishment. Letting go of unrealistic expectations allows space for self-kindness. Understanding genetic causes also explains why miscarriages are more common with increasing maternal age. As eggs age, the likelihood of chromosomal abnormalities increases naturally. This increase in risk is biological, not behavioral. It is not caused by delayed childbearing choices or lifestyle decisions, but by the natural aging of reproductive cells. Recognizing this distinction helps reduce judgment and stigma around age-related miscarriage risk. Biology explains risk without assigning blame. Even when testing is performed after miscarriage, many chromosomal abnormalities cannot be predicted or prevented beforehand. This uncertainty can feel frustrating for those seeking clear answers. The absence of a preventable cause does not mean care was inadequate or opportunities. It simply reflects the limits of current medical science. Understanding these limits can reduce the pressure to search endlessly for explanations that do not exist. Sometimes, knowing what did not cause the loss is just as important as knowing what did. Self-blame after miscarriage can delay emotional recovery and contribute to anxiety or depression. Thoughts like, "If only I had rested more," or "If only I had known sooner," are common but harmful. When people understand that genetic factors are the primary cause, these thoughts can be gently challenged and released. Healing begins when guilt is replaced with understanding and compassion. Education becomes a powerful tool for emotional recovery. This knowledge also affects how people approach future pregnancy. Fear of repeating the same mistake can lead to excessive restrictions or anxiety. Understanding that miscarriage was not caused by behavior allows future pregnancies to be approached with more confidence and less fear. It encourages balanced care rather than hypervigilance. Trust in the body can begin to be restored. Healthcare providers emphasize genetic causes not to dismiss emotional pain, but to protect patients from unnecessary guilt. This explanation validates grief, while clearly stating that responsibility does not lie with a pregnant person. Clear communication from medical professionals can be deeply reassuring during a vulnerable time. Truth, delivered with compassion, supports healing. Many people worry that a genetic cause means future pregnancies are doomed to fail. In reality, most genetic abnormalities are isolated events. Each pregnancy represents a new combination of genetic material and a new opportunity for healthy development. Understanding this restores hope and prevents catastrophic thinking. Past loss does not determine future outcome. Ultimately, recognizing that miscarriage is most often caused by genetic factors removes the heaviest emotional burden, blame. It allows grief to exist without shame and sadness without self-judgment. This understanding creates space for healing, resilience, and cautious optimism. You did not cause this loss, and you are not broken. Bleeding or spotting in early pregnancy does not automatically mean miscarriage. And many pregnancies with early bleeding go on to result in healthy births. Bleeding or spotting in early pregnancy is one of the most alarming symptoms a pregnant person can experience. It often triggers immediate fear that something is terribly wrong, even before medical evaluation occurs. This reaction is understandable, as bleeding is commonly associated with loss. However, medical evidence shows that bleeding in early pregnancy is relatively common. Up to 1/3 of pregnant individuals experience some degree of spotting or bleeding during the first trimester, and many of these pregnancies continue to develop normally. Understanding this prevalence can reduce panic and help people approach symptoms with calm rather than immediate despair. Bleeding is a sign that deserves evaluation, but it is not an automatic diagnosis of miscarriage. Clarity helps replace fear with cautious reassurance. There are many benign reasons for bleeding in early pregnancy: implantation bleeding, cervical sensitivity, hormonal changes, and increased blood flow to the cervix can all cause spotting without harming the pregnancy. In early pregnancy, the cervix becomes more vascular and fragile, meaning light bleeding can occur after intercourse or even a routine pelvic exam. These causes are common and often harmless. Without understanding these possibilities, people may assume the worst. Education helps broaden perspective and reduces catastrophic thinking. Not all bleeding carries the same meaning. The medical term threatened miscarriage is often used when bleeding occurs, but the pregnancy is still viable. This term can be frightening when seen on medical records or billing statements. Importantly, a threatened miscarriage does not mean that miscarriage will happen. It simply describes a situation where bleeding is present while the pregnancy continues. Many pregnancies labeled as threatened go on to result in healthy, full-term births. The label reflects observation, not prediction. Understanding medical terminology prevents unnecessary fear. Early ultrasound and hormone testing often help clarify what is happening when bleeding occurs. Seeing appropriate growth or a heartbeat can be deeply reassuring. When people understand that bleeding does not automatically signal loss, waiting for results becomes more manageable. Anxiety may still be present, but it is tempered by knowledge. This understanding allows individuals to focus on next steps rather than spiraling into worst-case scenarios. Information creates emotional breathing room. Bleeding experiences vary widely in appearance and intent. Light spotting, brown discharge, or brief bleeding episodes often have different implications than heavy bleeding with cramping. While all bleeding should be reported to a healthcare provider, not all bleeding requires emergency. Knowing this helps people respond appropriately rather than react impulsively. Education supports balanced decision-making and reduces unnecessary distress. Awareness empowers calm action. Block 6. Fear around bleeding can cause people to restrict normal activities excessively, believing that rest alone can prevent loss. While rest may be recommended in certain cases, it does not determine outcomes in most early pregnancies. Understanding that bleeding is not always linked to miscarriage helps reduce self-blame if bleeding occurs despite precaution. It reinforces the truth that early pregnancy outcomes are largely driven by biological factors rather than daily behavior. This knowledge protects emotional well-being. Bleeding in early pregnancy can also affect emotional bonding. Many people become guarded, afraid to feel hopeful or attached while symptoms persist. Recognizing that many pregnancies with early bleeding continue normally allows space for cautious optimism. Hope does not cause harm, and emotional restraint does not prevent loss. Understanding this can help people navigate early pregnancy with greater emotional balance. Fear does not have to dominate the experience. Healthcare providers often focus on reassurance when bleeding occurs, alongside reassuring finding. This reassurance is grounded in evidence, not false optimism. Knowing that medical reassurance is supported by data can help individuals trust guidance rather than assuming reassurance is dismissive. Clear communication strengthens trust and reduces anxiety. Reassurance is meaningful when understood. For those who have experienced miscarriage, bleeding can be especially triggering. Past experiences may intensify fear and emotional responses. Understanding that bleeding does not automatically mean loss helps separate past trauma from present reality. This separation is essential for emotional healing and coping in subsequent pregnancy. Knowledge helps break cycles of fear. Ultimately, recognizing that bleeding or spotting in early pregnancy does not always indicate miscarriage restores a sense of emotional stability. It allows people to respond with informed caution rather than immediate despair. While medical evaluation is always important, understanding the range of normal experiences reduces unnecessary suffering. Information transforms fear into grounded awareness. Some miscarriages happen silently, without pain or bleeding, which can be emotionally devastating but does not reflect negligence or missed warning signs. A silent miscarriage, often called a missed miscarriage, is one of the most emotionally shocking ways pregnancy loss can occur. In these situations, the pregnancy stops developing, but the body does not immediately recognize there may be no bleeding, no cramping, and no physical signs that anything is wrong. Many people enter routine prenatal appointments expecting reassurance, only to receive devastating news during an ultrasound. This sudden shift from hope to low scan feels surreal and deeply traumatic. Because there were no warning signs, people often blame themselves for not noticing something sooner. This self-blame is misplaced and unnecessary. Silent miscarriages are a known medical phenomenon and are not caused by inattention or neglect. The absence of symptoms can make a missed miscarriage especially difficult to process emotionally. People often feel betrayed by their bodies, believing that their instincts failed them. In reality, the body may continue producing pregnancy hormones for a period of time even after development has stopped. This can mask the loss and delay physical signs. Understanding this biological reality helps explain why someone could feel pregnant and healthy while the pregnancy was no longer progressing. Knowledge helps replace confusion with clarity and silent miscarriages often come with a unique sense of unlike miscarriages that unfold gradually with physical symptoms. Missed miscarriages are discovered abruptly. This suddenness can intensify grief and make it harder to emotionally adjust. People may feel numb, disconnected, or unable to process what they are being told. Recognizing that these reactions are normal responses to unexpected trauma is essential for emotional healing. Shock does not mean weakness. It reflects the impact of sudden loss. Many people replay the weeks leading up to a missed miscarriage, searching for signs they believe they should have noticed. This mental replay can be exhausting and painful. Medical evidence shows that there are often no detectable symptoms when a missed miscarriage occurs. Even healthcare providers cannot identify it without imaging or testing. Understanding that warning signs were not available helps reduce the burden of hindsight guilt. You cannot respond to information you never had. Decision-making after a missed miscarriage can feel overwhelming. Because the body has not begun the miscarriage process naturally, medical intervention is often discussed. Understanding the diagnosis helps people feel more grounded when considering options such as expectant management, medication, or a procedure. Clear explanations empower individuals to make decisions aligned with their emotional and physical. Knowledge restores a sense of agency during loss. Emotionally, missed miscarriages can create a sense of delayed grief. The pregnancy may have ended days or weeks before the diagnosis, but the emotional loss begins at the moment of discovery. This disconnect can feel confusing and disorienting. People may struggle with the idea that the loss happened earlier without their awareness. Understanding this timeline helps validate complex emotional responses. Grief does not follow the body's calendar. It follows awareness. Silent miscarriages can affect trust in future pregnancy. Many people feel heightened anxiety, fearing that loss could occur again without warning. This fear is understandable, especially after a missed miscarriage. However, it does not mean that future pregnancies will unfold the same way. Recognizing that this was a specific medical event not a recurring failure, helps separate past experience from future possibility. Fear deserves compassion, not dismissal. Support after a miscarriage is crucial, yet people may struggle to explain their experience to others. The absence of physical symptoms can make the loss feel invisible. Clear language helps communicate that the pregnancy had already ended before discovery, even if the body had not shown signs. Validation from others reinforces that the loss was real and significant. Being seen matters in healing. Medical follow-up after a miscarriage often includes reassurance about future fertility. Most people go on to have successful pregnancy. Understanding that silent miscarriages are not linked to behavior or vigilance helps rebuild trust in one's body. This reassurance can be a critical step toward emotional recovery. Hope can coexist with grief. Ultimately, recognizing that some miscarriages happen silently reframes the experience from one of perceived failure to one of biological reality. There were no missed warning signs and no actions that could have changed the outcome. Understanding this truth allows people to grieve without guilt and move forward with compassion toward themselves. Silence does not mean responsibility, it means biology. Recurrent miscarriage is now defined as 2 or more pregnancy losses of any type. An early evaluation is both valid and supported by updated medical guidelines. For many years, people were told that miscarriage evaluation should only begin after 3 losses, often leaving individuals feeling dismissed and forced to endure repeated heartbreak before receiving support. This outdated approach failed to reflect the emotional and medical realities of pregnancy. Medical guidelines have evolved. Recurrent miscarriage is now defined as 2 or more pregnancy losses, regardless of whether they were early, late, clinical, or biochemical. This change acknowledges that every pregnancy loss matters and that early intervention can be both appropriate and beneficial. Updated definitions reflect compassion as well as science. Early evaluation after 2 losses allows healthcare providers to identify potential contributing factors sooner. This may include genetic testing, hormonal evaluation, anatomical assessment, or immune-related investigation. While not every evaluation reveals a clear cause, ruling out treatable conditions can provide reassurance and guide future care. Waiting longer does not necessarily improve outcomes and may increase emotional distress. Early evaluation validates both the experience and the individual seeking answers. Including biochemical miscarriages in the definition of recurrent loss is a significant shift. These early losses were historically excluded, despite representing true pregnancy. Recognizing biochemical losses acknowledges implantation failure and early embryonic development issues as part of the reproductive picture. This inclusion allows people who experience repeated early losses to receive appropriate attention and care. Validation begins with recognition. Many people hesitate to seek evaluation because they fear being perceived as anxious or impatient. Updated guidelines affirm that concern after 2 losses is reasonable and medically justified. Seeking answers does not mean something is definite. It means taking proactive steps toward understanding reproductive health. Early evaluation can reduce uncertainty and empower informed decision-making. Advocacy is not overreaction, it is self-care. It is important to understand that even with thorough evaluation, a specific cause is not identified in many cases. This uncertainty can feel frustrating. However, the absence of a diagnosis does not mean the evaluation was unnecessary. It provides reassurance that major concerns have been ruled out. Knowing what is not causing the losses can be as valuable as finding a cause. Reassurance is a meaningful outcome. Updated definitions also help healthcare providers tailor care more effectively. People with recurrent losses may receive earlier ultrasound, closer monitoring, or supportive treatment. These measures are not always about preventing loss, but about providing emotional support and reassurance during early pregnancy. Feeling supported can significantly improve the pregnancy experience after loss. Care is both medical and emotional. Recurrent miscarriage can deeply affect mental health, leading to anxiety, depression, or feelings of hopelessness. Early evaluation acknowledges this emotional burden. By addressing concerns, healthcare providers can offer resource, counseling, and emotional support alongside medical care. Recognizing emotional impact is an essential part of comprehensive treatment. Healing involves both body and mind. Updated guidelines also help reduce stigma. When definitions change, they signal to society that early losses are meaningful and worthy of care. This shift encourages open discussion and reduces the pressure to endure loss silently. Validation at the institutional level promotes compassion at the personal level. Language shapes experience. Understanding that recurrent miscarriage is defined by 2 or more losses helps people advocate for themselves confidently. Knowledge empowers individuals to request evaluation without guilt. It allows people to enter medical conversations informed and prepared. Self-advocacy becomes easier when supported by evidence-based guidelines. Information is power. Ultimately, redefining recurrent miscarriage reflects progress in reproductive medicine. It aligns medical care with lived experience. Early evaluation offers reassurance, guidance, and hope rather than delay and dismissal. No one should have to prove their pain through repeated loss. Updated definitions prioritize care, compassion, and understanding. Even when medical testing does not reveal a clear cause, most people who experience miscarriage still have a very high chance of achieving a healthy pregnancy in the future. After miscarriage, many people place great hope in medical testing, believing that finding a clear cause will bring certainty and peace of mind. When test results come back normal, the absence of an explanation can feel deeply unsettling rather than reassuring. It is important to understand that unexplained miscarriage is extremely common. In fact, even after thorough evaluation, no specific cause is identified in a large percentage of cases. This lack of a diagnosis does not mean something was missed or that future outcomes are poor. It simply reflects the complexity of early human development. Uncertainty does not equal hopelessness. Medical research consistently shows that most people with unexplained miscarriage go on to have successful pregnancy. The odds remain strongly in favor of a healthy outcome. Each pregnancy represents a new biological event, with a new embryo and a new opportunity for normal development. Past loss does not biologically doom future attempts. Understanding this helps counter the fear that nothing was found means nothing can be done. Normal test results often signal a good prognosis. Many miscarriages are caused by random genetic abnormalities that cannot be detected through testing of the pregnant person. These events are isolated and unlikely to repeat. Because these abnormalities occur at conception or early cell division, they are not predictable or preventable. When people understand this, they can stop searching for personal flaws or hidden conditions. Random does not mean recurring. The emotional impact of unexplained loss can be significant. Without answers, people may feel stuck in a cycle of doubt and fear. Education helps interrupt this cycle by reframing uncertainty as a neutral outcome rather than a negative one. Not having a diagnosis often means that major structural, hormonal, or genetic problems have been ruled out. This absence of pathology is, in many ways, reassuring. Healthcare providers often emphasize prognosis when discussing unexplained miscarriage. Statistically, the likelihood of future success remains high. This information may feel difficult to accept when grief is fresh, but it reflects decades of reproductive research. Understanding probability does not erase pain, but it restores perspective. Hope, grounded in data, is powerful. People may feel pressure to pursue endless testing or interventions after unexplained loss. While evaluation is important, more testing does not always provide more answers. Knowing when testing is complete allows people to move forward rather than remain stuck in investigation mode. Trusting evidence-based guidance can reduce emotional exhaustion. Sometimes, reassurance. Unexplained miscarriage can challenge trust in the body. People may feel that something invisible is wrong. Medical reassurance helps rebuild that trust. The body is often capable of achieving and sustaining a healthy pregnancy despite past loss. Reframing the body as resilient rather than defective supports healing. Trust is rebuilt through understanding. Future pregnancies after unexplained miscarriage are often accompanied by heightened anxiety. This emotional response is normal and valid. Knowing that prognosis remains favorable helps manage this anxiety, even if it does not eliminate it. Early monitoring and supportive care can provide reassurance during subsequent pregnancy. Support matters as much as statistics. It is also important to recognize that success after loss does not erase grief. Joy and fear often coexist. Understanding that positive outcomes are likely allows space for cautious optimism without invalidating past pain. Healing does not require forgetting it, requires integrating loss into the larger story. Hope and grief can live together. Ultimately, unexplained miscarriage does not define future for most people will go on to achieve their goal of building or growing their family. The absence of a clear cause does not mean the absence. Medical evidence supports optimism grounded in reality. Even without answer, the future remains full of possibility. Experiencing miscarriage does not mean you are broken. With proper information, care, and support, healing and hope remain entirely possible. After miscarriage, many people describe feeling broken, as if their body or their future has failed them. This feeling is deeply understandable, especially in a world that often equates fertility with success and loss with inadequacy. Miscarriage can shake one's sense of identity and trust in the body. Even those who know intellectually that loss is common may still feel emotionally damaged. It is important to separate what happened from what it means. A pregnancy ending does not define a person's worth, strength, or capacity to become a parent. Loss reflects biology, not broken. Healing after miscarriage is not linear. Some days may feel manageable, while others feel overwhelming without warning. This emotional unpredictability does not mean someone is failing to. It reflects the depth of attachment and the significance of what was lost. Understanding that healing takes time allows people to release pressure to move on quick. Grief deserves patience, not deadline. Accurate information plays a powerful role. Understanding why miscarriage happens and what it does and does not mean helps quiet fear and self-blame. When people replace myths with medical truth, emotional recovery becomes more possible. Knowledge does not erase pain, but it provides stability and reassurance. Information becomes a form of care. Support is equally essential. Healing does not require facing loss alone. Whether through partners, friends, family, support groups, or mental health professionals, shared experience reduces isolation. Being heard and validated helps transform grief into something that can be carried rather than endured. Connection is a cornerstone of healing. Medical care after miscarriage is not only about physical recovery, it is also about reassurance, guidance, and future planning. Feeling supported by healthcare providers helps restore confidence and trust in the process of care. When people feel informed and respected, fear gives way to empowerment. Care is both clinical and compassionate. Hope after miscarriage may feel fragile or even frightening. Many people fear hoping again because hope once led to. This hesitation is protective, not pessimistic. It reflects wisdom gained through experience. Understanding that future success is still likely allows hope to return gradually and gently. Hope does not have to be rushed. Future pregnancies after loss often carry emotional complexity. Joy may coexist with fear, and excitement may be tempered by caution. These mixed emotions are normal and do not diminish the value of future experience. Acknowledging this complexity allows people to approach pregnancy with honesty and self-compassion. There is no single right way to feel. Healing also involves redefining strength. Strength is not avoiding pain, but continuing forward with vulnerability and courage. Choosing to try again, seek care, or simply survive grief is an act of resilience. Loss can reshape a person, but reshaping does not equal damage. Growth often follows fracture. Many people eventually find that miscarriage changes how they view themselves and others. Empathy deepens, priorities and resilience grows. While no one would choose loss, it can lead to profound emotional insight and this transformation does not justify the pain, but it honors the journey through. Meaning can emerge without minimizing grief. Ultimate miscarriage does not define the end of a story. It is a painful, not the. With time, information, care, and support, healing is possible and hope remains. You are not broken. You are human, resilient, and deserving of compassion. The future is still open.